Hello, we are here with the chairman of the third working group at the AFP Perio Workshop 21st actually, and it's about non-dental biofilm-induced gingivitis and periodontal conditions. So we're here with Professor Iain Chapple and Professor Tony Sculean, and we're going to start with you, Iain. What is actually the definition of non-induced conditions, gingivitis and periodontal conditions, not induced to biofilm and dental plaque? And how important are they and how common are they? What is their scope, if you can?
So the non-dental plaque biofilm-induced gingival diseases, by definition, do not have plaque biofilm, dental plaque biofilm as their primary etiological agent. So these represent conditions that may be gingival lesions or conditions that are localized to the gingiva. They may involve other parts of the oral mucosa. They may be systemic conditions, so other parts of the body may be involved, such as the skin, for example. Or they may be gingival manifestations of a systemic condition, which could be quite serious, such as leukemia or lymphoma or, a dermatological condition. So they are, in and of themselves, quite rare, but as a group, they're not uncommon as a group. It's a big group. There are over 100 of these conditions, and we have been investigating just under 90 of them in this particular workshop, which represents a huge challenge. So whilst they're rare, it doesn't mean they're not important. They're incredibly important because sometimes they cause significant morbidity to patients and premature mortality. So it's really important that we educate the profession in how to identify that this is not gingivitis, it's something else, and this something else may be important, and therefore I need to think more carefully and refer the patient to a specialist, either in an oral health specialist, like in periodontal or oral medicine, or in fact to a physician for investigation, which may include biopsy, blood investigations, etc.
I keep the point that it's not that rare as we think it is, because when we face a patient like that in our practices, then it's a challenging situation. So, Tony, what are you thinking about that?
So we realized when we discussed with the participants who come from all over Europe that the level of training is very different. For example, many of us have not been trained to diagnose these conditions. We are trained to treat periodontal diseases. We have surgical skills, we can place implants. However, when it comes to these special problems, we realize that we have problems with diagnosing, but also with, for example, biopsy removal or different types of incisions. So we strongly feel and recommend that this aspect should be integrated in the postgraduate curricula in all countries in Europe. I think that's a very important aspect that we were surprised how little we know about that and how little training we have.
That's a very important point, and nowadays it's under stressed. I think we have to stress this out, and because we can see only what we are trained, the others we skip it, totally, but they exist. So one final question to both of you: what are the challenges you are faced or you are still facing in order to produce guidelines for your working group, Iain?
The challenges are huge. The first challenge is the sheer volume of these particular conditions. The second challenge is that the evidence, with the exception of one or two conditions like lichen planus, where there are a lot of RCTs, but the challenge really is the quality of the evidence is low. And so a lot of what we are doing is expert consensus based, really. And in fact, you have to be very careful. When you have one or two individual case reports, they might be for a particular new treatment or an experimental treatment, and they'll show a positive result. But actually, that treatment may not be appropriate. And therefore, sometimes it can be dangerous to overinterpret what one or two case reports say. So we're trying to synthesize out the evidence from case series. If there are RCTs, fantastic, but in most of these conditions there aren't. And that's the biggest challenge, is giving a balanced view that keeps the patient safe and is appropriate.
Yeah, very important. Tony?
Basically, it was a challenge for us because over the years, we were used to have rather strong evidence or at least moderate evidence or on any type of treatment. And now we realize that when we have to deal with this issue, the evidence is very limited, as you correctly pointed out. And we have basically to look at the entire problem from another point of view. And then to include also expert opinions. And we are lucky to have experts from these fields in Europe because they have a lot of knowledge. And of course, you need to work also with your peers, with medical doctors and internal medicine, etc., etc. It's very important.
And if I may add to that, I completely agree that these are largely medical conditions that require medical management, not surgical management. And the difference in approach with medical conditions is the real challenge is getting to the diagnosis. The treatment is prescribe a drug, refer to a psychiatrist maybe, whatever. So the big challenge is reaching that diagnosis. So we're spending a lot of time talking about management as opposed to treatment. So it's not, for us, a treatment guideline, it's a management guideline, and the two are quite different.
And that's an important point in this entire workshop.
Absolutely. So thank you very much in that point for your very useful insights and clarifying things and enlightening us for what you are doing. I wish you all the best success, and we hope we're going to meet soon for more details. Thank you very much.
Thank you.